Okay, our next topic is going to be vaginal discharge. And we're going to go into the characteristics and the management of different causes of vaginal discharge, okay? And let's start out with bacterial vaginosis. Now, bacterial vaginosis is our most common cause of vaginal complaints in the United States. It's commonly seen in post-menopausal women, but in the stem of the question, it can be a teenage girl, it can be a sexually active girl, but it's commonly seen in post-menopausal women. It's not sexually transmitted, and this is the one we know as Gardnerella vaginalis. Now, basically, what do we want to do as a first step in any type of vaginal discharge? What we want to do is a speculum exam, okay? We want to do a visual inspection first, and then we want to do a speculum exam. And the speculum exam on Gardnerella vaginalis, also known as bacterial vaginosis, is going to show us a grayish white discharge. And on KOH, you're going to get a positive whiff test. Okay, it's going to be a malodorous discharge, and there's going to be a fishy smell on the KOH preparation. A big characteristic I want you to remember is that absence of itching and burning. This is pretty important, and you're going to see why it's important later on, okay? But there's the absence of itching and burning. So this is what makes it characteristic. The pH is also different from all the others in that in bacterial vaginosis, it's the only one when you do the nitrazine paper, it's the only one with a pH of greater than 4.5. All the other ones we're about to talk about have a pH of less than 4.5, but bacterial vaginosis has a pH of greater than 4.5, and microscopy is going to, of course, show us our characteristic clue cells. And our treatment of choice is simply going to be oral or vaginal metronidazole for the patient. So Gardnerella vaginalis, remember, fishy odor. KOH, positive whiff test, is the only one with a pH over 4.5. Clue cells, and we're going to use oral or vaginal metronidazole in these patients. Next, we have Trichomonas vaginalis. This is going to be the second most commonly sexually transmitted disease in the United States. Second most common sexually transmitted disease in the United States. What's the first one? The first one, as we know, is obviously chlamydia. And trichomonas is actually going to be number 2. And unlike bacterial vaginosis, Trichomonas vaginalis is going to come in with itching, burning, and pain with sexual activity. They're going to have dyspareunia, okay? And the appearance is going to be a strawberry-like appearance. The pH here is also unlike bacterial vaginosis in that the pH is going to be less than 4.5. And on microscopy, we're going to see motile organisms. So basically, we're going to see bugs swimming under the microscope, okay? What I want you to remember is that when we did the speculum, because remember the first step is the speculum, right? When we did the speculum, there's going to be a frothy green discharge with inflammation and edema. Okay, this is also going to be different. It's going to be a pale green, frothy, watery discharge, and it's also known as the strawberry cervix. Our treatment here is going to be oral metronidazole, and since it's sexually transmitted, remember, we have to treat both the patient and the patient's sexual partner. Next cause of vaginal discharge is going to be Candida vaginitis. And you want to look for the diabetic patient in the stem of the question, a patient who's been on antibiotics such as doxycycline. The pregnant patient is more predisposed to Candida, as well as obese patients, okay? Now, the patients are going to present with itching, burning, and pain with sexual activity, just like Trichomonas vaginalis, except on speculum, which is our first step in management, we're going to see a curdy white discharge with inflammation and edema. So as we see, Trichomonas and Candida both have inflammation and edema, but Candida is going to have a curdy white discharge with inflammation and edema. Okay, it's going to be cottage cheese type of discharge, and the pH is going to be less than 4.5, because remember, the only one with a greater than 4.5 pH is going to be bacterial vaginosis. Microscopy is going to show pseudo hyphae. And our treatment of choice is going to be a single oral dose of fluconazole or any vaginal azole creams, okay? So with Candida, what are we looking for? A cottage cheese-like discharge, pseudo-hyphae on KOH, history of diabetes, antibiotics, pregnancy, obesity, etc., okay? And finally, we have physiologic discharge. And basically, most cases of vaginitis or discharge that are non-specific are going to be physiologic. And basically, this is going to be increased in risk of increased risk in patients with prolonged and ovulatory conditions such as PCOS. So if you see PCOS or any condition that's anovulatory for a long period of time, I want you to think of physiologic discharge. What you're going to see is a thin, watery cervical mucus discharge with the absence of burning and itching. So what are the only two that have an absence of burning and itching? Bacterial vaginosis, which we know is very straightforward with the fishy odor and the only one with the pH over 4.5, right? And the only other one that's going to have an absence of burning and itching with cervical discharge is going to be physiologic discharge. It's going to be thin and watery, and the pH is going to be less than 4.5. So which are the two that have an absence of burning and itching? It's going to be bacterial vaginosis and physiologic discharge. How do you tell the two apart? Bacterial vaginosis, pH over 4.5. Physiologic discharge, pH less than 4.5. There you go. And if you want to tell the difference between trichomonas and candida, you're going to just look at the speculum exam, which is our first step, okay? Microscopy is going to show an absence of WBCs, clue cells, pseudohyphae, or motile organisms. So pretty much this is a diagnosis of exclusion, and treatment of choice is going to be steroid contraceptives with progestins. So when we get vaginal discharge, remember, we're going to look at the characteristics. We're going to manage them by first doing a visual inspection and then our speculum. And based on the speculum and what we see, we are going to next do a vaginal pH with nitrazine paper. And if it's greater than 4.5, we have our diagnosis, okay? And next step is going to be microscopy, and then we're going to treat the patient, okay? So this is pretty much the most high yield topics that we need in vaginal discharge. Enjoy.